Knee injuries are the leading cause of sports-related surgeries. And this month, I'll be having my third knee surgery, where they're basically planning to redo everything I had done in 2009 during my first surgery after I tore my ACL and meniscus in my left knee. To try to minimize some of my fear, I want to document my journey to spread awareness about ACL and meniscus tears and the different options you have for reconstruction or revision surgery, and also look at how the recovery has evolved since my first surgery 15 years ago. Before I keep going, one important note is that right now, my ACL is not torn. And as you hear my story, you'll understand more why I need this revision surgery. I tore my ACL 15 years ago during the last 4 minutes of a varsity basketball game when I was going up for a rebound and pop. I'm pretty sure the whole gym heard it. This is a common sign that you've injured your ACL. And like mine, they often happen without contact. Females are more likely to injure their ACLs compared to males. And according to this study, girls most often injure their ACLs while playing soccer, which was then followed by basketball, then softball, and volleyball. You do have different graft choices for ACL surgery. To reconstruct my ACL in 2009, I went with an allograft, which is cadaver tissue from a dead donor. In the long haul, the 6 to 9 months overall will be about the same recovery, and one surgeon I interviewed even said that it would be at minimum 8 months recovery before returning to sport. Also, my parents didn't like the idea of me having to heal in 2 places if I went with an autograft, which would be taking tissue from my patellar tendon, hamstring, or quad to then become, my ACL. In a separate video, I'll get into the story of where the cadaver tissue I was given came from. Something important to note, which came out after I had my ACL surgery in 2009, is that the research shows that it's better for younger patients to go with an autograft because chances of re-tear are higher when going with an allograft. But after my first surgery, there was a problem. I kept tearing my medial meniscus and had a second surgery in 2011. Your meniscus is cartilage between the bones of your knee that provides cushion and acts as a shock absorber. In 2012, I tore that meniscus a third time. And through all this, I kept seeing the same surgeon. And I remember he said to me, well, if you're gonna keep playing basketball, you should get it fixed through surgery. But if you're not, then don't worry about it. So I didn't worry about it. I gave up basketball. I was tired of having surgeries, and even when I was playing, the game just wasn't the same. Throughout the rest of my teen years and adult life, I've continued to be active, even playing basketball every now and then, but always with caution. There were moments where it felt like my knee was going to give out and would do something like this. In November of 2023, I began having severe pain in my knee. I couldn't walk up and down the stairs, and I had a limp. So I got an MRI. With strengthening exercises, my knee soon began to feel a little better where, you couldn't tell anything was wrong. But the MRI showed that I have a bucket handle meniscus tear, which is one of the most serious types of meniscus tears, and it can only be fixed through surgery. I talked to 2 surgeons, different from the one who did my surgeries 10 plus years ago, and they both said that they think I keep tearing my meniscus because the ACL is loose. It's not torn, it's intact, but it's loose, possibly causing the meniscus to get caught in there and tear. A loose ACL also increases my risk of a re-tear and creates an overall unstable environment for my knee. I cried after the second surgeon told me this, because that first surgery I had in 2009, it was a really difficult recovery for me mentally and emotionally, including physically. But he said to me, insanity is doing the same thing over and over again and expecting different results. I've been letting fear keep me from doing something that I should have done years ago.